Intravenous therapy setting up. Verify written prescription. Observe 14 rights of the client. Explain the procedure to the patient and significant other and secure consent if necessary. Assess patient pain. Choose appropriate site, location, size, or condition of the vein. Wash hands before and after the procedure. Prepare necessary materials for the procedure. IV tray with solution and administration set. IV cannula, forceps soaked in antiseptic solution. Alcohol swabs or cotton balls soaked in alcohol with cover, plaster, gloves, splint, and IV hook. Sterile gauze 2x2 or transparent dressing. Check the sterility and integrity of the IV infusion set and other devices. If moisture is present or the entire package is damaged, discard immediately. Fill the drip chamber to at least half and prime it with fluid aseptically and close the clamp after. And put back the cover to the distal end of the IV set. Verify doctor's prescription in doctor's order sheet, countercheck IV label, IV card, infusate sequence, type, amount of additives, if any, and duration of the infusion. Prepare necessary materials and place on IV tray. Check sterility and integrity of IV solution. Perform hand hygiene. Lift container of IV pole and invert it quickly. Remove the spike from the empty old container, being careful not to touch the tip of the spike to avoid contamination. Steady the new IV container and insert the spike carefully. Hang on IV pole. Reopen the clamp and check the drip chamber of the administration set on tubing and adjust flow. Place IV label on the IV bottle, filling up all the entries. Changing the IV tubing and solution. Verify doctor's prescription in doctor's order sheet. Counter-check IV label, IV card, infusate, sequence, type, amount of additives if any, and duration of the infusion. Observe the 14 rights of the patient. Prepare necessary materials and place IV on tray. Check sterility and integrity of IV solution. Carefully remove protective cover from new solution container and exposed bag entry site. Open the new IV site and close the clamp on new tubing. Remove the protective covering from infusion spike using sterile technique. Remove cap at the end of tubing. Released clamp allowed fluid to move through the tubing until air bubbles have disappeared. Closed clamp and recap end of tubing. Loosen tape at IV insertion site. Don clean gloves, carefully removing dressing and tape. Place a sterile square gauze under catheter hub. Place new IV tubing close to the IV site and slightly loosen protective cup. Close clamp of old IV tubing. Steady the needle hub with non-dominant hand and remove tubing with dominant hand using a twisting motion. Set old tubing aside while maintaining sterility. Carefully remove the covering or cup from the new administration set and insert the sterile end of tubing into catheter hub. Twist to secure it. Remove square gauze from under the needle hub. Tape connection if necessary. Remove soiled gloves. Open flow clamp on the IV tubing and check the flow. Regulate IV flow according to the physician's order. Label IV tubing if necessary. Discard used equipments properly and perform hand hygiene. Perform hand hygiene. Carefully remove old dressing, but leave tape that anchors the needle or catheter in place. Discard properly. Inspect IV site for the presence of inflammation or infiltration. Discontinue and relocate IV if noted. Loosen and gently remove tape, being careful to steady catheter with one hand. Use adhesive remover if necessary. Don gloves. Cleanse the entry site with an alcohol swab using a circular motion, moving from the center outward. Allow to dry. Follow up with povidone iodine swab using the same process. Apply sterile gauze or transparent polyurethane dressing over entry site. Reapply tape strip to needle or catheter entry site. Secure IV tubing with additional tape if necessary. Check the IV flow rate if accurate and if system is patent.